Section 6, the skull. And like I said, to me, this is probably the harder section. Some of you might disagree, and that's perfectly fine. I think everybody's a little bit different. But if I were to choose the sections, this one's probably the toughest. Because the skull, so I think of the cranium, the head. Well, it is made up of 22 bones. Your head that sits on your shoulders is made up of 22 semi-separate bones. 8 cranial bones, and then 14 that make up your face. And then 3 bones, 3 of your smaller bones that make up your inner ear. Stirrup, anvil, and hammer. Have you heard of those before? The cranium is the part of the skull that encloses and protects the brain. It provides attachment for muscles that cause your face, your forehead, and things like that to move. And it contains a lot of sinuses, paranasal sinuses. It helps to reduce its weight, which is good, so you can carry your head around. And it increases vocal resonance when speaking and things like that. These sinuses, though, are off, when you have a sinus headache, a lot of times you can feel where those sinuses actually are. Frontal bone. So I actually have taken apart my skull, and I have it kind of labeled. Frontal bone should be easy to remember. Frontal forehead, front part. So the frontal bone includes supraorbital, which would be the sinuses that you can't see. They're inside of the head. But supraorbital means above the eye socket. Supraorbital foramen, and then your frontal sinuses. So the supraorbital foramen is an opening, and the supraorbital foramen is a very small opening. Parietal bones, there are 2, one on each side. So parietal bones would make up the top of your cranium, or the top and the sides. They join together these sutures, little lines. This would be the sagittal suture, and this would be the coronal suture. So I think coronal crown, like a crown sits on your head, the coronal suture would sit right in between your frontal bones and your parietal bones. Sagittal, like a sagittal cut, the sagittal is going to separate your parietal bones. Your soft spot, which we'll talk about, a fontanelle, a baby's soft spot, is where those sutures have not come together yet. So it's soft, there's cartilage, and that's why it's more dangerous for a baby in that area, because the bones have not come together yet. So picture, here's the supraorbital foramen. Like I said, that one's very small. This would be the frontal bone. Here's the coronal suture, parietal bone, parietal bone. And I guess while I have this up, I'll point out some more. I expect you to know the 3 that we just talked about. I expect you to know the mandible, the maxilla. Zygomatic is your cheekbones. Temporal should make sense. Temporal is in your temple area. The ones that are in your eye sockets, probably not so much. Sphenoid is in the back of your eye socket. Some of those I probably won't. Nasal, the top part of your nose, I do expect you to know. The vomer is like the bone that separates the 2 compartments of your nose. But these inner eye sockets I probably won't have you memorize. Sinuses, frontal sinus, and I don't get headaches. I don't get headaches very often, but if I do, that's probably where I get a headache. So, or sinus infection. I have had sinus infection. That means that your sinuses probably have some bacteria in it, causes headache, causes pressure, actually sometimes causes people to become dizzy when they have a sinus infection. But in your face area, your frontal sinus sits behind your frontal bone. Maxillary sinus, this is your maxillary bone, so that's where the name comes from. Sphenoidal sits in, this would be the sphenoid bone. And ethmoidal sits in the ethmoid bone. So you can see that these sinuses are just open cavities within the bones of your skull. And that is also when someone's in a very bad accident and they talk about like the face being crushed and reconstructive surgery and things like that. One, your cavities give a little less resistance, so it's a little easier for those bones to be broken. Nose, oftentimes if you have your nose broke, they don't even do anything really to fix it, and then you end up, my husband has kind of a crooked nose, and he doesn't know if he's broken it for sure, but yep.
So are those cavities like filled with stuff all the time? Or
Air.
Just air?
Yep.
Empty?
Yep, they're empty.
So when you get like infections and stuff, that's when they do fill with stuff?
Right. You're going to get bacteria that are in those cavities. Yep. Yep. Good question. Okay. Cranium, occipital bone is the base or bottom part of your skull. So occipital is going to be back here on the bottom. Lambdoid suture, probably the most important is the foramen magnum. I do need you to know that. Foramen magnum is the second largest foramen or opening in your body, and that's where your spinal cord will enter. That is in the occipital bone. And then occipital condyles then are these projections where basically if you kind of feel back behind your ear, you can feel those bones that dip down, and that would be your occipital condyle. Temporal bone, like I said, temporal, temples, forms the side and base. It's also found on the inside. Squamous suture, that's going to be the flat suture between the temporal bone and the occipital bone. External acoustic medius, what is that for? Hearing. That's basically, your ear is all cartilage, so when your cartilage disintegrates and all that's left is your bones, there's the opening that your ear goes into, because when you pick up information, that has to go to your what? Brain. So there's the opening that will lead into your brain. So that's the external acoustic medius. Mandibular fossa, mastoid process is the larger bump that's down here, styloid process, and then zygomatic process is this that goes here, and we'll talk more about that a little bit later. So zygomatic deals with your cheekbone. So zygomatic process is on your temporal bone. So I will explain that now. Here's my temporal bone, here's my zygomatic bone. So where the temporal bone attaches to the zygomatic bone is the zygomatic process on the temporal bones. When we talk about the zygomatic bone, there will be a temporal process that's going to attach to the temporal bone. So they kind of flip-flop. Sphenoid and ethmoid, we'll talk about those a little bit. Help form the base, so actually they're going to be found inside of the orbital areas also. A little bit of the sides of the skull. The one thing here, the sella turcica, so inside of the skull, there's this little divot right here that's called the sella turcica. That is where your pituitary gland sits. It is very well protected. Pituitary gland is the most important gland, master gland in your body. It does sit inside the sphenoid bone. You should probably know that. Ethmoid then is way back more on the inside. Cribriform plates, Christogala, yeah, these I probably will not have you memorize so much. Nasal conch would be part of that, and that's just some of the ridges that are inside of the nose. So these two, sphenoid, make sure you know the sella turcica. But as far as labeling, I probably won't have you do that. Facial skeleton, 13 immovable bones and 1 movable one. So basic shape of the face, maxilla, upper jaw. So I always say to kind of practice this. If you touch like your maxilla, so your maxilla is right here, and you talk, does this bone move at all? No.
Make it move.
The only bone that moves without you lifting your entire head, the only bone that moves is your jaw, which is your mandible. So maxilla is the upper part of your jaw. Hard palate, it's going to make up the roof of your mouth. Floor of your orbits, bottom of your eyes, sides of the nasal cavity. It's going to help house your teeth. And your maxillary sinuses are going to be found in that bone. That's probably the most important part there. So maxilla, top. Palatine bones. Here again, probably not the most important ones. I don't even know if I have those labeled. Nope, I don't. They're L-shaped, they're small, they're more inside of the walls of the nasal cavity, so you're not going to see that on the outside of the skull. Zygomatic, yes, you need to know this one. Zygomatic are your cheekbones. So zygomatic bones are your cheekbones. Going to go back to the lateral sides of your eyes a little bit. Temporal process, like I said, temporal process on the zygomatic bone. Zygomatic process on the temporal bone. So here again, if I look at my cheek, there's really almost a little line right here. So my cheek, zygomatic bone, here would be the zygomatic arch, is this line here. Zygomatic bone, temporal process. Temporal bone, zygomatic process. That's where they hook together. Lacrimal bones are down. They're going to be, I do have those labeled, right back in here. Part of the middle of your orbits, or where your eyes are at. Nasal bone, I do expect you to know. Nasal bone is the bridge of your nose. So that one you should know.
So does that explain why noses are so pointy?
Noses will have a different shape. Part of it can deal with the structure of your nasal
Okay,
bone.
so black people, why are they so flat?
Actually, when we do like forensics, yeah, different ethnicities have different facial shapes. So if you find a skeleton, especially, and technically it's called negroid, a negroid skeleton, a Caucasian skeleton, an Asian skeleton, or mongoloid, are very easy to tell the difference because of their face.
Isn't it that like the Negroids have like a wider nose arch or whatever?
Yep, they do. Their nasal shape is different. Vomer bone, like I said, makes up the septum. It's the middle part that separates your nasal cavities. Nasal conch are just little, basically, how do I want to, scrolls. I don't really like that. But basically, inside of your nose, there's a couple little areas that stick out. So inferior are going to be on the bottom. Mandible, this one you do need to know. Mandible, the lower bone, it's the only one that moves, very important. Supports your teeth. The arch and stuff, probably not so important. But the mandible is the only one that moves in your entire face. So here, if I look at these, here is the coronoid process, and here is the mandibular condyle. So it is where your mandible actually joins